welcome back to our video about model posting video. I am Aida and this is
Nabila Kamruddin.
Okay, so today we are going to discuss about marijuana in a what is the topic?
Marijuana. Does it have a medical value?
Yes. So what we are going to talk today is about marijuana in the medical value. Marijuana is categorized into two parts, which is marijuana in a medical value, which is can be produced or can be given by a health practitioner, and the second part is marijuana that can be illegalized by someone and by anyone, and this is that can cause addictive. So what we are going to discuss today is the first part only, marijuana in a medical term. So up to you, partner Nabila.
So, marijuana is actually also known as cannabis, and it is derived from a type of plant known as Cannabis sativa. So, marijuana is actually used to treat a number of different medical conditions, including Alzheimer's disease, appetite loss, cancer, Crohn's disease, epilepsy, and also glaucoma. And recently, FDA has also approved first drug comprised of an active ingredient derived from marijuana to treat rare and severe forms of epilepsy.
So marijuana, we know it can treat our disease, treat the disease with lesser the adverse effect. So the best supported medicinal use of marijuana is as treatment of a chronic pain, and there's a strong evidence that the medical cannabis can help with the muscle spasms. And we know that there's a report that say there's equally strong evidence that marijuana can help with multiple muscle spasms related with the multiple sclerosis, and other type of muscle spasm respond to marijuana as well. So people that use medical marijuana to treat diaphragm spasms that are untreatable by other, they describe this as prescription. That is what we can call that marijuana can be used as a medical treatment, because when other drugs cannot perform well, so there is marijuana for you. How about your opinion?
So, despite recent studies shows that marijuana actually has little side effect when induced, but actually it is undeniable that marijuana has also its short-term and long-term effects. So some of the example of short-term effect is that people who consume marijuana will have altered senses. For example, they'll be seeing brighter colors, and they'll also have altered sense of time, changes in mood, impaired body movement, which is associated with inability to control the body, and difficulty with thinking and problem solving, and also impaired memory, and also they'll be having hallucination and also delusion. Marijuana has also posed considerable long-term effects such as breathing problem, increased heart rate, and also problem with child development during and after pregnancy. And if we take marijuana on a regular basis, it can also cause intense nausea and vomiting.
Okay. But I have one thing about the good side of marijuana. It says that one of the most common reasons that why United States allow medical marijuana, because we know that there are more than 30 countries that legalize the uses of medical marijuana, and it uses to treat and prevent the disease of the glaucoma, which increase the pressure in the eyeball, damaging the optic nerve and causing the loss of vision. So, marijuana decreases the pressure inside the eye. According to the National Eye Institute, studies in the early 1970s showed that marijuana, when smoked, it lowered the intraocular pressure, IOP, in people with normal pressure and those with the glaucoma. And for now, the medical consensus is that marijuana only lowers IOP for few hours, meaning that there's not good evidence for it as long as term treatment right now, because it only lower it for few hours. So we can't consider it as treatment for the lifelong treatment, because few hours is not considerably to say as cure. It's only like false you know the it just it lower down the pressure, but just lower down for a few hours. So it's actually not treating yet.
Just treating the symptom.
Yeah, it's just treating the symptoms. Well, I think that's all from us. Thank you.
Thank you. Apa conclusion kita?